新冠疫情爆发3年之后，中国忽然宣布解除封控，重启国门，导致了包括美国在内的许多国家纷纷对来自中国的旅客来祭出新的入境防疫措施。然而，中国政府却扬言要以这个对等的措施进行反击。白宫的新冠因应小组的官员纳希德·巴迪利亚在接受美国之音独家专访的时候呢，除了详细的说明新的入境政策，也警告说，出示虚假的病毒检测证明可能会面临美国政府的刑事犯罪指控。他并且呢也反击了中国的批评。此外呢，从中国入境到美国的旅客也可以来获得新冠疫苗检测套件，甚至是口服的治疗药物。以下是专访的内容。
Thank you so much, Dr. Bhadelia, for accepting the interview with VOA. So we're going to talk about, the newly implemented COVID restrictions on the travelers from China. So what type of test results will be accepted from the entrance from China? Does it has to be from a reputable company like Abbott with a QR code, or a doctor or a lab's note, or simply a photo of the test kit?
Thanks so much, Paris. So what's required is a viral test that looks for a current infection. So it can be a nucleic acid amplification test, such as a PCR, or a rapid antigen test, as long as it's testing to see if you might currently be infected. And what passengers are required to do is to present the test results. That includes a certain amount of information, that is the sample collection date, the name of the entity or the lab that conducted the test, of course passenger information, and the type of the test that was used. Passengers can also use self-tests if they have a component which includes telehealth services associated with the manufacturer, which includes real-time video and audio supervision. So for example, when I've traveled globally in the past, I would do the self-test with the proctored telehealth service. I would then receive a test result in my email, which I can then either take with me to the airport or upload if the airline allows that beforehand. And there's a whole list of the accepted tests available and accepted by the CDC on their website.
Of course, we know a lot of travelers so desperate want to get out, want to come to the United States. So who will be checking the certificates, and how will the TSA authenticate a legitimate test result, and how will they identify a counterfeit test result?
Yeah, Paris, I think the important part is that airlines here will be looking for the test results to have that necessary information, and they'll make a determination when a translation is required, for example. So this is an important point for travelers. If you're traveling and the test results that you have are in another language, you may want to call the airline beforehand just to ensure that it has the information that you need to be able to be accepted for travel.
Can we fully trust the airline to have that knowledge of identifying a fake result?
One of the things that's required when passengers travel is an attestation that says that they are, in fact, presenting a test that's accurate, that they are negative by that test. And so that is another measure where we're asking passengers, of course, as they have in the past, used as approved and effective tests, and to comply with the requirements as they exist.
When the travelers landed here at the airport in the United States, will the TSA ask them to produce that test result for second verification?
We ask that passengers keep their tests. They may or may not be asked, but that's not a requirement. But they should hold on to that test result, of course, that they had during their travel with them.
Does the TSA also, have that knowledge and ability to identify a fake result?
So the airlines will actually be looking at the results before the passenger boards, because the goal, of course, is to ensure that people who are positive are not traveling potentially on an airline, or an airplane full of others who may not know that they're positive.
But we also know that could be bad actors. So if that do happens, someone have a fake test result produced and was able to board the flight. What would that be a punishment, offense, and what would that be? The punishment would be besides of just denial of the entry.
A good point. The CDC order mentions that activities such as providing inaccurate or misleading information to the government could be subject to criminal offense charges. So that's part of the CDC order as well.
Do you know what's the what kind of offenses or the criminal charge is going to be?
I think the main thing here is that we've placed travel testing requirements in the past, and we actually have had many passengers comply with the safe and effective test, and we believe that they will continue to do that.
And we do know this new COVID rule has been implemented since last Thursday, and China is sort of like fully open yesterday, Sunday. Have we already detected some of the travelers who are tested positive, or do we have any data just for the past few days?
I currently do not have that data to share.
The travelers through a third country will also be under this program. How do you trace someone travel to the United States through a third country, especially if that traveler enter the third country, stay there for a couple of days, and then come to the United States?
Yeah, this is important and it can be confusing for passengers, so I'm glad you're covering this, Paris. One of the things that the order requires is that if you are in one of the designated airports as a stopover before you come to the U.S., and you have been in either China, mainland China, Hong Kong, or Macau, that you are going to get a test that you will, in those designated airports, you will also be required to present a test that you've done before travel to the United States. So the three airports that are designated are Vancouver International Airport, Toronto Pearson Airport, and in South Korea, Incheon Airport as well. At those three airports, you will also be required, as someone who may have traveled to mainland China, in Hong Kong and Macau, to also present a negative test. The reason those airports were picked is because majority of the passengers traveling who may make a stopover actually travel through those three airports as well.
What happened if the traveler then test negative or produce a negative test result when entering the United States, but then tested positive? What's the next step?
The big goal here is to identify, patients or travelers who may be positive, so we're able to slow the appearance of new cases, the genomic data for which we don't have enough background on. If you test positive, one of the things that CDC, in general for all travelers requires is that you monitor yourself for symptoms here. You test yourself 3 to 5 days after international travel. And if you are one of those folks who did test and you're tested positive, you should isolate at home, stay a distance away from others in your household, provide good ventilation in your home, follow all the good practices the CDC provides for isolation of patients who may be positive. Here's an important part. You may qualify if you're a high-risk patient for treatment with antiviral medications, the oral antiviral medications that we know can help reduce severe disease or hospitalizations. So one of the other things that we ask patients to do is just to call your healthcare provider to make sure that you test yourself to see if you're eligible for those antivirals. Or if you don't have one, look at covid.gov, which can provide you places where you might be able to get access to treatment.
You're talking about isolating at home, but some of the travelers might actually be staying in hotels, which among a lot of strangers. How do you prevent a mass gathering or a super spreader event happen if the traveler entered when he or she was negative, but then test positive? And if he's not a U.S. citizen, how do they seek help, especially with the treatment that you just mentioned?
Yeah, Paris, I think this is important. The testing requirement applies to anybody, regardless of citizenship. And so if you're here, again, if you test positive, it is the same guidance that CDC has for anybody else. If you're in the hotel, you self-isolate in the hotel. You wear a mask, and that you are able to stay at a distance from others. And again, you should be able to go to covid.gov to be able to see if there are places that you might be able to access treatment if you're a high-risk patient.
If they are not U.S. citizens, will they still be able to get the health care they need?
Here in the U.S., I think ability to get access, is going to be where you are in terms of from your hotel to where the clinics are. But you should be able to check to see. Again, the access will be what is your international insurance and other factors. But yes, absolutely, anybody who's sick should be able to seek care.
You mentioned earlier that the South Korean airport is one of the hub that we're gonna have the tests verified. We just saw on the news that there's the South Korean government confirmed a Chinese tourist entered South Korea, tested positive, and then didn't comply with the local rule for quarantine and escaped and went on for a shopping trip, potentially expose a lot of people to the COVID danger. How would you enforce what is the CDC's requirements to people who enter or similar cases like what we're seeing in South Korea?
I want to step back, Paris, because I think it's important to note that this pre-departure testing is not meant to be punitive to individual passengers, right? What is our goal? Is a mounting international concern about the surges in PRC right now with COVID, but more importantly, the fact that there hasn't been transparent sharing of epidemiological data as well as genomic surveillance data. Just to give you a sense, right? It's not so much that someone's positive, it's that they are coming from an area that we don't have as much data about the type of viruses that might be circulating. So China's sharing of genomic surveillance data compared to globally what other countries are doing or regionally what's being shared is much, much lower. China shares about 1.1 sequence per million people in its population. That's compared to us. We share about 537 sequences per million. UK shares over 600 per million people in their population. Thailand, 31 sequences per million people. We need to see a lot more genomic data to get a sense of what viruses are circulating. The other thing that we haven't seen is good real-time data on ICU admissions or hospitalizations. And the reason these things are necessary is that if there is a variant of concern, lack of access to this data delays identification of those variants, and then it leaves our public health officials less prepared to respond to new variants that may arise that could increase the severity of disease. It could impact our diagnostics, our vaccines, our treatments. And so it's not so much about the individual passenger. It's ensuring that we have a better understanding of the epidemiological situation and that we are allowing slowness, the ability to not have positive travelers potentially travel in that scenario to come to the U.S.
Talking about that data, of course, we all know United States and WHO urging China to be more transparent, which hasn't happened yet. But we know CDC is expanding its genomic surveillance program in the airports. Would that be a good opportunity for the United States to actually gather those data? But would you also at the same time worry about, if you target on some of the flights that came from China, some people might actually complain about discrimination actions, something like that?
Yeah, let me start by saying it is not specific to flights from China. I'm so glad you brought that program up. One of the reasons why is because I wanted to talk about the fact that the pre-departure testing is just one of a suite of measures that the U.S. is taking to respond to the public health the situation in China. One is the pre-departure testing, but the other, as you mentioned, is CDC is expanding their travel genomic surveillance program, a voluntary program where travelers can get tested after they arrive. And that allows us to potentially pick up people who may have tested negative before they start their flight and may now be positive. It's now expanding to more airports, and it's expanding to nearly 500 flights from 30 different WHO regions. So it is not meant to be targeted to one area, although we are increasing the frequency because we are a globally united community, of course, and we want to ensure that we are looking at all international travels.
So with that program, will that also help the United States to kind of get a peek in what's coming up next, maybe the next variant?
Absolutely. Again, it's a voluntary program, but it's yet another layer of how we ensure that we are safe as a global community. Other things that we want to continue to do is U.S. has been the biggest single country donor of global COVID vaccinations. And now, to date, I think we're at over 680 million vaccines donated to 116 countries and economies. Yet another layer with which we want to ensure that we as a global community stay safe. And then lastly, I wanted to mention, aside from the work that CDC is doing here with the traveler genomic surveillance program, they're also working with partner countries around the world to ensure that the global genomic surveillance infrastructure is stronger.
You mentioned about the vaccine. Of course, that comes into my next question. We know the United States had the best vaccine, as President Biden said, the best and also the most efficient ones. Then would you, the travelers from from China to the United States, can they get this new mRNA vaccine like Americans do? And if so, would you recommend when they come in here and get the latest boosters or the vaccine?
Yeah, CDC recommends that everybody stays updated with their vaccination. We know that it helps reduce severe illness, hospitalization, and God forbid, deaths as well. And anybody who's interested in getting vaccination, when you arrive in the US, you can check vaccines.gov. And again, if you want to access tests, you can also look at covid.gov. And I think I've previously mentioned the same thing with treatment. Anybody who's seeking medical care should seek medical care and can look at more information that's available for sites at covid.gov as well.
The treatment and the vaccines and the test kit, would that be the cost? Would that be coming out of the taxpayer's pocket, or the traveler or whoever requires that service will have to pay out of pocket themselves?
Well, I think the way to look at this is that every positive case that we identify and isolate is allowing us to ensure that more community transmission is not occurring. And so it is actually in the global good, in the greater good, to ensure that anybody who requires a test is tested. And if they identify themselves as positive, that they're able to isolate.
Last question. We chatted earlier about this China's reaction to global, new measurements against their travelers from China, and they have stopped issuing visas to South Koreans and Japanese. China had also talked about reciprocal actions against the United States. If this is something the White House worry about, the Chinese might implement something against U.S.
I think the biggest part of reciprocity here is ensuring that we're all sharing enough data with the global community. And so we're hoping that we'll continue to see sharing of genomic sequences from China, that we'll see real-time data on hospitalizations and ICU admissions. I do want to remind you that China has an existing requirement for all international travelers, including those coming from the US, that matches what we have also put into place. So that already exists as a measure that's equal in place.
Thank you very much, Dr. Bhadelia.